This is my student support system. Keep watching, keep learning.
Now we come to the procedure of injection techniques. Intramuscular injection, subcutaneous injection and intradermal injection. Preparation of injection tray. Before starting any procedure, we need to make a tray. So the injection tray should contain a small tray which have the various sizes of syringes. Okay, that includes zero point 0.1 ml syringe, 0.5 ml syringe, 2 ml syringe, 5 ml syringe, 10 ml syringe, 20 ml syringe as per need of the patient. The a small tray with various sizes of syringe and then it transfer forceps in the jar. Separate jar, sterile cotton swabs in a bowl which should be covered, kidney tray, paper bag, boiled sterile swabs in a bowl, medication card, medication and sterile water for injection, file to cut open the ampules, needle hub cutter, gloves and other PPE as per need. And in preparing an injection tray for immunization of the children, the tray is known as immunization tray or vaccination tray. This tray should contain all the articles discussed here along with the vaccines in vaccine carrier and immunization card instead of medication card. Other articles are same. Now preparation of client. Always keep rights of drug administration in mind while giving the injection. And for rights of drug administration, you can watch the previous lecture of oral medication. Identify the client correctly. Ask client to use washroom if desired before injection. Explain the procedure to the client. Provide privacy with curtains or drapes. Keep attention of the client away from the medication by friendly conversation or curious articles or toys in case of giving injection to the children. Place the client in comfortable positions suitable for the types of injection, for which type of injection we are giving. Select right route for injection by confirming the physician's order, medication card and nursing notes. Perform hand hygiene, then put on gloves. Select the site for IM injection. Here first we are discussing about the steps for IM injection. Mainly 4 sites are used. Gluteal muscles, here 2 sites are there, dorsogluteal site and ventrogluteal site. Then deltoid muscle site and vastus lateralis muscle. Take out the syringe and fill it with medicine either from the ampule or vial. Change the needle if it is used to pierce the rubber seal of the vial. Ensure that air is removed from the syringe in this way and keep in mind, do not touch the needle shaft. Never you should touch because it is sterile and going inside the body. Clean the site with antimicrobial swab. But in case of vaccination, clean the site with sterile water or boiled or cooled sterile swab. For dorsal gluteal site, first identify greater trochanter of the femur and posterior superior iliac spine and then make imaginary lines like this. In this way, this is posterior superior iliac spine, make one line here and this is greater trochanter, make one line here. So cross is made, 4 quadrants are there on each buttock. So here outer upper quadrant is the site for injection in dorsogluteal site. So this you can select either on left side or right side. And for ventrogluteal site, place the tip of index finger on the superior iliac spine and middle finger on the iliac crest. Then the V formed here, this is the site for proper injection into the ventrogluteal site. Then if you want to give injection at vastus lateralis site, especially it is the choice of the site of choice in the vaccination in children giving IM injections. So here this is the area on lateral aspect of mid thigh, part between greater trochanter and knees. Then for deltoid side, locate the lower edge of acromion process and form a rectangle here, and this is site for small quantity of medication. It is the best site for IM vaccination as normally 0.5 ml or 1 ml amount of vaccine is given. For example, when we give TT vaccine or COVID-19 vaccination, this is the site of choice. After cleaning the site, we have selected the site, now we clean the site. Now displace the skin slightly in a jet track manner by pulling the skin down or to one side about 1 inch or 2.5 centimeter. Spread the tissue between the thumb and fingers to make the skin taut and insert the needle with quick movement of wrist in this way so that the pain is minimized. Here keep in mind 90-degree angle for intramuscular injection. After inserting the needle, withdraw the plunger to check the blood is there in the syringe or not. If there is no blood, it means it is in the muscle, and then give the medication slowly by pushing the plunger. Remove the needle quickly and clean the site with sterile swab if small amount of blood is oozing. Now give a key message to the client about drug or the vaccine which is given. Now we come to the steps for subcutaneous injection. For example, same subcutaneous injection we can give in the vaccinations. Okay, that is best example. So for subcutaneous injection, all steps will remain same. Only the angle is changed. Okay, while giving the vaccine or injection. In subcutaneous injection, 45-degree angle is given, so the medication should go below the dermis into the subcutaneous tissues. Okay. Then and keep in mind we will insert only 3/4 of the needle. Okay, so that it will not go deep in the muscle. Subcutaneous site can be selected for injection as per choice of the client and as per the amount of the medication. Upper aspect of the upper arm, outer aspect, and upper back below the scapula, abdomen and thigh. These are the sites for subcutaneous injection. And for intradermal injection, all steps will remain same. Only the angle by which we are inserting the needle is 15-degree or less than 15-degree, so that the medication is given between dermis and epidermis. And while giving this medication, a wheal is formed like this. A small wheal is formed. Then the injection is okay. Fine. Aftercare of client and article. In all types of injection, aftercare will remain same. After giving injection, inspect the site. If there is oozing of blood, then apply pressure with sterile cotton. Help the client to take comfortable position in the bed or chair. Wash hands and perform hand hygiene. Watch the post-injection reaction for half an hour. Record the procedure in nurse's notes and other registers as per policy of the institution.
My student support system. Keep watching, keep learning.